Good afternoon. My name is Dr. Jazz Atwal, and I'm the Deputy Chief Provincial Public Health Officer for Manitoba. I have a few comments to make before I pass it over to Dr. Reimer. October 18 was the deadline for public sector workers to be fully vaccinated. I want to thank all Manitoban public sector workers for their ongoing efforts to protect vulnerable Manitobans and their colleagues and getting fully vaccinated. Today, I have data related to public sectors and levels of vaccination and testing. I'm relaying this information on behalf of departments and ask that specific questions be directed to communications for follow-up in relation to the next few slides. This data is of the end of day Tuesday, October 26, 2021. Next slide, please. Across Manitoba Civil Service, there are approximately 12,400 employees in the core provincial public service. There are just over 5,800 designated positions that require full vaccination. Currently, 429 are undergoing regular testing. The current rate of compliance for designated positions is 99.8%. Next slide, please. Across Manitoba health systems, there are approximately 42,000 employees in healthcare that are considered direct care workers. 36,269 direct care workers have indicated they are fully vaccinated. 1,788 direct care workers require testing. 184 direct care workers are unvaccinated or decline to volunteer their vaccine status and refuse testing. 33,541 staff have been validated as being fully vaccinated. Next slide, please. Validation of voluntary disclosure forms continue for 2,877 staff. Paperwork continues to be manually entered into the system, and managers remain responsible for confirming the vaccination status of staff as they arrive at work, with those whose status is not confirmed required to undergo testing. A significant proportion of remaining direct care workers who have not provided voluntary disclosure are casual staff who have not worked in the past 3 weeks. Next slide, please. Across Manitoba education, there are 38,643 designated public education staff and 2,412 independent staff. The education data represents designated staff, including substitutes, temporary and casual staff in positions across Manitoba. Substitutes, temporary and casual staff make up 24% of designated staff reported. There may be some substitutes, temporary and casual staff that work in multiple school divisions. Manitoba Education has received information that identifies the following: 34,336 designated public staff and 2,204 designated independent staff have provided proof of vaccination. 3,129 designated public and independent staff have chosen testing. 94% of those testing are within public schools. Next slide, please. 143 designated staff who are at unpaid leave of absences related to compliance with public health orders. 97% are within public schools. Please note that education staff that refuse testing will be addressed by the employer in a progressive discipline approach. Some staff may have also resigned. While the majority of school divisions report no significant impacts related to staff being on unpaid leave or refusing testing, schools or school divisions in regions where there are lower vaccination rates will have a higher proportion of staff undergoing testing, as well as those refusing testing. Manitoba Education is working with the Manitoba Schools Boards associations and divisions to understand and mitigate these challenges. The best protection against COVID-19 is to get vaccinated, to get tested, and to follow all public health orders designed to keep you, your family, and your community safe. Whether it is for or against COVID-19, the seasonal flu, or childhood vaccinations, vaccination is a game changer for you, your family, and your community. New public health orders came into effect Tuesday morning with a few minor changes. While Manitoba continues to ward off a significant uptake in case numbers, we are not out of the woods yet and need to remain vigilant by getting vaccinated, following the public health orders and the fundamentals. The municipalities of Cartier, Headingley, McDonald, Richaud, the towns of Niverville and Richaud, St. Francis Xavier, and Taché are geographically located in the Southern Health Centre Sud Health region. Considering their vaccination rates are more consistent with that of Winnipeg, as well as their proximity to and regular commuting to Winnipeg, the new public health orders will see these select municipalities treated like Winnipeg and the rest of the province. This impacts retail the most. Currently, the permitting retail capacity is 50% in the Southern Health Centre Sud Health region. This will remain unchanged for that region. Permitting retail capacity is 100% in Interlake Eastern, Northern, Prairie Mountain Health, and Winnipeg Capital Region, and will now include the municipalities of Cartier, Headingley, McDonald, Richaud, St. Francis Xavier, and Taché. All other public health orders remain unchanged. The new orders came into effect Tuesday, October 26 at 12:01 a.m. and will be in place until November 16. The orders will keep the pandemic response system at restricted orange, with schools at caution yellow. I am pleased to announce that Tabor Home has restarted admissions and that they had suspended prior to the October 18 required testing and vaccination policy kicking in. I also want to clarify some possible confusion around entry into an indoor location that requires proof of full vaccination. The location could be a community center, a hockey rink, or arena, or a dance theater. Proof of full vaccination is required, excluding the youth participating in the activity. Parents and coaches are required to be fully vaccinated and show proof to enter. A recent negative test does not qualify as proof of vaccination. A recent negative test does not negate the need for proof of vaccination. You must show proof of vaccination to enter this type of facility. By trying to find a way around the rules, you often put a fellow community member and volunteer in a difficult and unfair position. This is a time to be kind to each other. We're also hearing about places of worship or other facilities hosting indoor movie nights with vaccinated and unvaccinated people attending together. The rules for indoor facilities hosting movie events, such as this, are clearly outlined in the public health orders. Proof of vaccination is required for everyone aged 12 and older to attend. The orders regarding places of worship does not apply to this type of activity. The same is true for other businesses or facilities where proof of vaccination may not be required. If you have any questions about the orders and hosting at events, Manitoba Government Inquiry is available to assist you further. I ask Manitobans to follow the rules and not to try to find ways around them. They are in place for a reason: to reduce the spread of COVID-19 and to reduce the strain on our healthcare system. We all need to do our part to help end the pandemic, and following the current public health orders is one of the best ways to do that. The seasonal flu vaccine is now available across the province, and I encourage you to get your vaccine as soon as you can. There are many ways to stay well this winter, and getting your flu shot is just one way. Stay active as best as you can within the current public health restrictions. Eating a variety of foods is another great way to support our physical, social, and mental well-being. Getting 8 hours of sleep a night helps keep you well rested. All of these things combined with getting your seasonal flu vaccine are steps you can take to reduce the chance of getting the flu and requiring healthcare services. This year, like last year, we need to reduce the strain on our healthcare system. The flu vaccine and high-dose vaccines are available at local public health offices, nursing stations, doctors' offices, and community clinics. Pharmacists can also provide immunization services to people 7 years of age and older. I recommend that you contact your healthcare provider before you go to get your vaccine to ensure that they have it available. Halloween. Halloween is just a few days away, and Manitobans are strongly encouraged to focus on the fundamentals to help stop the spread of COVID-19. While children less than 12 years of age are not yet eligible for vaccination, there are some additional measures suggested below to help reduce the risk of exposure while still enjoying Halloween activities. This includes staying home if you're sick, even if your symptoms are only mild, washing, sanitizing your hands frequently, covering your cough, practicing physical distancing when you are with people outside of your household. Wearing a mask in indoor spaces is required by the public health orders and recommended outdoors where you cannot physically distance. Trick or treat with a small group only. Limit to household members or a few close friends you normally have social interactions with. Avoid crowded indoor parties and follow current gathering size limits. Maintain a 2-meter distance from people outside of your group, take turns, and wait until any group ahead is gone. Decorate your household and yard for distance viewing. Wear a non-medical mask when physical distancing cannot be maintained or is unpredictable, including outdoors. There is more guidance listed online. Visit manitoba.ca. I wish everyone a safe and fun weekend. Thank you, and I will now pass it over to Dr. Joss Reimer.
Thank you, Dr. Atwal. Good afternoon, everyone. I'm Dr. Joss Reimer, medical lead of the Vaccine Implementation Task Force. Today, Manitoba is expanding its recommendations for the third dose of the COVID vaccine. This is building on recommendations from the National Advisory Committee on Immunization. So they recently recommended a third dose be made available to seniors who are living in congregate housing, such as personal care homes and assisted living. As a result, in Manitoba, our clinical team is also recommending that third doses be provided to residents in congregate settings such as assisted living. Health regions will begin to work with these elderly housing sites in the coming weeks to make sure that there are plans in place to have third doses available to those residents. There are about 500 of these sites across the province, and the rationale for including them in the recommendation is the same as why we expanded third dose recommendations for people who are living in personal care homes. So immune responses among older people can be less robust, and they can wane more quickly over time. And based on age and the way we did the rollout in the spring, these were also some of the first people in Manitoba to receive their first and second doses. And so maybe later in the process of waning immunity than some other Manitobans. So moving away from our older population to younger people, I also wanted to talk a bit more about the vaccine for kids aged 5 to 11. So if you have a school-aged child or you provide care for one, you have likely heard that it looks like it may soon be their turn for a COVID-19 vaccination, and you likely have some questions. The latest news is that the FDA in the US, their medical advisory group, has recommended the Pfizer vaccine for 5 to 11-year-olds. So they've indicated that the benefits to this age group outweigh the risks, but this is not yet a final approval for use from the US. This is a part of their approval process, and we are monitoring their developments closely. Review of the vaccine for children in this age group in Canada is underway by Health Canada. Pfizer formally asked Health Canada for approval of the vaccine last week after submitting preliminary data on the pediatric vaccine in early October. The company said the results were comparable to those recorded in the Pfizer-BioNTech study of people aged 16 to 25. So we still don't know exactly when the vaccine will be approved for 5 to 11-year-olds, but health officials believe that medical recommendations and approvals could come as early as mid-November. Once the vaccine is approved for kids, the National Advisory Committee on Immunization will weigh in on whether the benefits of the shot outweigh the potential risks for young children in Canada, and this will also be a part of our decision-making in Manitoba. So that's the next step in the process. And then Manitoba will be able to lay out more details about how we might start this next phase of our immunization campaign. We know that the vaccines work, and what we're seeing is that more and more cases are showing up in unvaccinated populations, and that includes children under the age of 12. Luckily, we're not seeing many severe cases in children at this time, but we are seeing some. Kids under 12 make up about 1/3 of COVID-19 cases overall, and kids under 12 make up 75% of cases in schools right now. So we want parents of youth under age 12 to be ready and to feel confident to decide to immunize their child once the COVID-19 vaccine is approved and recommended by NACI and Manitoba for these young people. In the meantime, if you have questions, ask your pediatrician, ask your family doctor, your nurse practitioner, or your healthcare provider. For our part, In the task force, we're looking at a wide range of locations where parents can have their children immunized with their consent, such as doctors' offices, pharmacies, and community and pop-up clinics. There will also be clinics held in schools and after school to make it easier for families to get their children vaccinated. And I am very much looking forward to updating Manitoba families on this in the weeks ahead. So speaking on a different NACI recommendation, NACI released a statement this week indicating that the ideal interval between dose 1 and dose 2 would be 8 weeks instead of 4 weeks. We are reviewing this new guidance in detail with our medical advisory team and don't have a recommendation change ready today for Manitobans. But we do agree that a longer period between first and second doses does provide stronger protection against the virus over the longer term. But what we need to consider is how we balance that against the reality that we're still in a fourth wave of this pandemic. There is also significant benefit to providing as much protection as possible in the short term with the current shorter window between doses and the plan to address the longer term protection with booster doses over time. So as I said, at this time, we don't have any changes in our approach to announce, but we will update Manitobans following our review. And then finally, yesterday, Dr. Rusin and I had the pleasure of participating in a student-led town hall for youth in grades 7 to 12 across the province. And I just wanted to let the youth know that I was so incredibly impressed with the depth and the thoughtfulness and the quantity of the questions that they asked. About 75 classrooms participated. The video is also available online at protectnb.ca if anyone would like to watch it. There were so many great questions. I think one of my favorites was a student asked about consent and whether or not it meant that the government was signing off on any responsibility if anything bad happened after the vaccine. And this was such a great question because it gave us the opportunity to talk about how important it is to report to public health if there's any bad side effects or even any unexpected event that happens after the vaccine, because it's important for public health to be involved and to know if anything is going on, like how we learned about myocarditis. These things can be very rare, and so we really want people to tell us when they've had some sort of unexpected event so that we can monitor and determine all the information that we need to bring back for the next time that somebody needs to consent. So, I just want to thank the students, the teachers for participating, for becoming more well-versed on the topics of vaccines and COVID, and for doing their part to become vaccinated to protect themselves and their community. So thank you to all of them. And with that, we can take your questions.
Thank you, doctors. A reminder to our reporters on the line, if you have follow-up questions that we don't get to today, please email us at newsroom@gov.mb.ca. You will have one preliminary and one follow-up up first this afternoon, possibly from CBC Radio Canada. Simon, are you there?
Yeah, and no questions.
Thank you.
Thank you.
From CBC Manitoba, Bart.
Dr. Atwal, we have a spike of cases in Northern Health, 60 today. The active cases in Norway House is up to 226. What further measures is that community, is public health, is any other authorities working there doing to stem what is now the largest outbreak of this fourth wave?
Yeah, thanks for that, Bart. So, we do have a small outbreak in Thompson that was related to an event. So that is being actively managed by public health in Thompson, and that seems to be under control at this point. There are a number of cases in a few First Nations communities, but Norway House has the most significant impact there. So there are a number of active cases there, and we're working with leadership there. Public health is working with First Nations Health Branch and community leadership as well in relation to measures for that community and having a response related to testing, case and contact management, and offering AIA. So we'll continue to work with our partners and work with the communities to mitigate risk in that community specifically as well.
We had seen as of Thursday our running average go down as low as 83 cases per day for Manitoba. It's now up to 108 and climbing. We're seeing higher daily case counts for most of the past week. I'm going to ask about modeling. I know it's not a precise thing, so please don't. I know there's a tendency for yourself and your colleague, Dr. Rousseau, to say, we don't know for sure. Of course, you don't know for sure, but based on the growth we've seen in the last week, what range do you think, potential range, do you think we're going now for the next 2 or 3 weeks that now we're back into what appears to be some exponential growth again?
Well, I think when we look back about 5 weeks now, our case numbers have fluctuated between 80 on a 7-day average up to 100 for a short period of time, came back down a little bit. Now we're creeping back up again. So we have sort of gone up and down a little bit over the past 5 weeks. So it is sort of hard to predict that future. We're getting more and more vaccine out there as well. We're doing a lot of targeted approaches to get the unvaccinated vaccinated. We have a lot more testing involved as well to help promote vaccine uptake and also to capture cases so it mitigates risk in relation to case. So, there's different models that can be looked at. From a projection of 2 or 3 weeks out is really hard to anticipate. Realistically, we've been sort of, you could argue, a bit of a plateau, with between 80 and 100 for the past 5 weeks. Could we see that for the next 2 weeks? I think that's very much possible. It wouldn't surprise me if it went up 5% perhaps, or 10% on a rolling 7-day average. It is really hard to predict, and it'll depend on how, all of us in Manitoba interact with each other and adhere to the orders, and in relation to what to do with the fundamentals. So again, if one is sick, stay at home and go get tested. That is paramount in our ability to manage and curtail COVID-19 in Manitoba. We still continue to see a number of patients where their first test is at the time of hospital admission. So I believe 50% of our new hospital admissions, their first test is at the time that they present to hospital. So that poses risk where we're missing out on contacts in relation to that. So again, want to stress the importance of adhering to public health advice to help mitigate future cases and impacts to the acute care system.
From the Canadian Press, Steve.
Oh, hi there. Dr. Atwal, I know you ran down some statistics on the uptake among various sectors in the public service. Just wondering how you feel about the uptake. It seems to be high in most of the sectors. I know it varies between, say, health and education, but are you encouraged, discouraged? How do you feel about the stats that you've seen?
I just saw the numbers this morning, so I am encouraged by the numbers. I haven't looked at the percentages specifically, but I think they represent a real good uptake and compliance and adherence with public health advice. A lot of great work done by these individuals and organizations to protect not only themselves, their families, but fellow Manitobans. I think it opens our eyes a little bit. We're able to create a little bit of a dialogue here with some of these sectors and with some of these individuals to try to encourage and promote vaccine uptake and to look at what is preventing one from getting vaccinated as well. So we'll work one-on-one if we have to find out what is the issue and try to work through those issues and try to mitigate future issues related to not having been vaccinated and working in one of these areas as well.
And Dr. Reimer, you talked a little bit about, the vaccine expected to become available for kids aged 5 to 11 in the not too distant future. And I'm just wondering, what do you tell parents who might be a little hesitant? Because the surveys we've seen suggest that people might be more hesitant about getting young children vaccinated more than themselves.
Yeah, I would say that it makes a lot of sense to be cautious about these decisions for your kids. The message that we've given out over and over throughout this pandemic is that, elderly Manitobans are at higher risk of severe outcomes than young people. And so parents do need to think about what's best for their kids. We haven't seen the data in Canada. However, the FDA has shared their submission, and we can assume that it's likely the same information in Canada. And the FDA Advisory Committee looked through the risks of the vaccine for this age group and the benefits. They looked at hospitalization rates, they looked at myocarditis, and found that even though we know that young children have lower risks of severe outcomes, the benefits of the vaccine to them still outweighed the risks of the vaccine. And so if we were to see that same information in Canada, obviously our numbers are different. We need to analyze things in the context of our own community. But if we have a similar analysis that comes from NACI in Canada, I think it's really important that parents look to NACI as a source of reliable and trustworthy information, because that's what NACI does, is they really spend a lot of time to make careful and cautious recommendations about what's best for Canadians. So I really appreciate parents that are really thinking carefully about this. And we hope to be able to provide them with all of the information that they need to make the best decision.
From CTV Winnipeg, John.
Hello, Dr. Atwal. I just have a question in regards to Halloween. I'm wondering, do you feel it's safe to have festivities, activities this year, such as trick-or-treating? And can you give us a sense for what the risk is for people who are, say, handing out candy, and for the unvaccinated kids who are actually doing the trick-or-treating?
That's a great question. So we provided some points today in relation to Halloween and trying to make it a safe Halloween. There's also information available online at manitoba.ca as well. I think the risk is low here. If we're practicing the fundamentals and, as a person giving out candy or a household giving out candy or partaking in that, if you're sick, let's turn off those lights and maybe not hand out that candy, stay at home and get tested, right? Get tested until you get your test result back and your symptoms resolve. If you're otherwise well, I think it's safe to hand out candy and try to distance yourself from individuals as well. You could always wear a mask as well. It's Halloween. It's probably good to wear a mask, and you could fit right in with the kids there as well, and take part in a costume as well, and that'll provide some safety for yourself and also for the trick-or-treaters. For the trick-or-treaters out there, there's going to be a lot of kids out there. We do message that we want kids to, go into smaller groups, look at households or another, few individuals that child normally plays with or gets together with. This is outdoor activity as well. If there's groups waiting in front of you, wait till they're done at the door before you go up to that door and say trick or treat as well. Wash your hands regularly as well. Again, as a trick-or-treater, if you're a child and you are sick, perhaps, the recommendation here is not to go trick-or-treating and to go get tested as well. So that reduces the risk for yourself and for your friends and your community members as well. So in general, the activity of trick-or-treating, I think, is safe. I think there's just a few things here that all of us can do, whether we're giving out candy or trying to get candy to make it safer. And, that was outlined today, outlined in the answer right here, and also available at manitoba.ca as well.
Thank you. I appreciate it, Dr. Atwal. For Dr. Reimer, I see that in the latest surveillance report, there's significantly higher percentage of breakthrough cases in people who had the Pfizer vaccine as compared with Moderna or AstraZeneca. And I'm just wondering, is this because more people received Pfizer, or is it because the other vaccines have greater efficacy, or is there something else going on here?
Yeah, so it's absolutely what you were saying. Most Manitobans received Pfizer. That was what we had by far the largest number of doses. So there's just a lot more people who would be at risk of being that breakthrough case than there are for the other vaccines that were provided in Manitoba. And Manitoba is a relatively small jurisdiction, so we try to be very cautious analyzing the effectiveness of the different vaccines here, unless we were to see something quite dramatic here. But what we've seen globally is really a great performance of the mRNA vaccines over the long term, with, as we've mentioned, some waning immunity over time in elderly people with health conditions. And with AstraZeneca, we've seen more waning. And so that's why we've recommended a booster dose for people who received 2 doses of AstraZeneca in Manitoba. So I would say that, there's nothing in Manitoba's data that's different than what we're seeing in the international community. And we need to be very cautious interpreting because we are such a small jurisdiction.
Thank you.
From City News, Mike.
Good afternoon, Dr. Reimer and Dr. Atwal. My question is a follow-up on the Halloween question. You mentioned washing your hands frequently. Can you just elaborate on why that's important for people who might be focusing more on the mask wearing and the risks through that during Halloween?
Well, washing our hands is fundamental in how we try to prevent infections. On the public health side, it's a universal way of protecting yourself, not only from COVID, from other viruses as well, or even bacterial infections as well. But when you're handling products, I mean, there's always a chance that, there could be some virus there if we're dealing specific with COVID. But from a good hygiene perspective, again, before you touch your mouth with your hands or your nose, your eyes with your hands, before you eat, you should always wash your hands to help reduce the risk of, exposing yourself to any sort of infection, not just COVID as well.
Thanks for that. And my follow-up question is a question from my colleague. They say, does Manitoba Health have any concerns about the fact that the owner of Heebie-Jeebies outside of Winnipeg, which employs 170 staff members, 110 of which are costume actors, scaring and frightening people, the owner says they do not know how many of the 170 staff, including those actors, are vaccinated. One infectious disease expert says the scene is concerning. And how does Manitoba Health feel about this type of environment?
And what was the business again? I didn't hear the name.
It was Heebie-Jeebies, just outside of Winnipeg.
Sure. Yeah. So the public health orders, we've always talked about vaccine requirements for the public, right? We have some proof of vaccine there. It's for public individuals going into a place of business. Businesses in general, except for certain ones, again, with the testing mandate, they have options to make vaccination mandatory as well. When we're looking at a risk perspective, with this business here, I believe everyone has to be fully vaccinated to go through the business. It does mitigate that risk because it's the public interacting with each other. When you're dealing with, as an employer with employees, they do have to look at creating a safe workplace as well and making it safe for the public. So, we would look at ensuring that there is distancing there where distancing is required and other precautions as well within the business to help protect the public as well. So again, I'm not too sure on the entire makeup of this particular business. My understanding is a lot of it is outdoors as well, if it's analogous to some other businesses that are the same. But I would strongly encourage everyone to be vaccinated. And as a business owner, that business owner can mandate that their employees be vaccinated as well.
From CHVN, Taylor.
Hi, good afternoon. We see that, a lot of kids are getting COVID in this wave. Can you just explain how they're actually contracting this virus, considering most of the adults they'll be around are likely vaccinated?
Yeah, so that's a great question. So as we rolled out vaccine, we rolled out vaccine to those who are greatest at risk initially, and those were the most elderly or in certain settings, and we kind of brought the age down. There's obviously a shift in cases. So we were protecting those who were vaccinated, and obviously the numbers of cases in those age groups declined and has sort of pushed down toward the younger age groups. So right now, when we're looking at vaccine eligibility, obviously it's 12 plus. And so those under 12 at this point cannot access a vaccine, and that's soon to change as well. But it's a natural sort of progression in how who would be at risk in getting the infection. When we're looking at youth, we're looking at these individuals, or looking at the unvaccinated population, virus is spreading. So there is virus out there. Virus isn't hidden in one area. It is all over. We're seeing cases in all regions as well. And when that virus spreads, some people, again, are symptomatic. They're practicing those fundamentals. Some people might have some mild symptoms, and some people we know aren't doing what we're asking from a public health perspective as well. And that's where that increased risk there is to transmit to other people, because public health can't get involved in case and contact management. So we are seeing, again, the unvaccinated disproportionately impacted from a case generation perspective. And obviously that impacts hospital and ICU admissions as well, where those who are unvaccinated end up in the ICU and hospital in greater proportions as well. So when we're looking at specific questions about younger kids getting infection, they are getting it from perhaps other individuals they're interacting with, whether it's outside of school activities, family get-togethers, maybe their parents aren't vaccinated, and there's that was the first point of exposure within the house. There's a number of ways that happens. But that all happens essentially from those who aren't vaccinated. Now, that being said, there are some vaccinated individuals who get the infection, obviously, and can communicate this disease or this virus onto others. And that's because we know the vaccine is not 100% effective, but it is very good at preventing one from becoming a case and becoming symptomatic and causing transmission to others. And most importantly, it prevents that individual from having a severe outcome like hospitalization or even death. So again, the more people that get vaccinated who are eligible, the greater we protect those who can't get the vaccine. And it protects those who can get the vaccine, but for various reasons, they can't mount a very good immune response. So again, we do encourage vaccination amongst all age groups that are eligible. And again, we should be expanding that soon to younger age groups once we get approvals.
Thanks. And this question's for Dr. Reimer. Do you have any advice for parents who, feeling anxious and trying to get as much information as possible about this vaccine for their young kids?
Could you repeat the question, Taylor?
Yeah, Dr. Reimer, do you have any advice for parents who are feeling anxious about the possibility of this vaccine for their younger kids and, are doing, some extra online research?
We seem to have lost Dr. Reimer. Dr. Atwal?
Sure. I think Dr. Reimer sort of answered this question a little bit earlier. Parents, I think a lot of parents likely will be a bit concerned about or a bit worried about providing the vaccine to, let's say, their 5 to 11-year-olds that are looking for greater information. And I think what we've always recommended, what we've always said is, trust your healthcare provider, who you get your healthcare from, to ask those questions. If one is looking online, do not go to social media. Social media is not the place to get information. Go to trusted resources. Go to, there's federal government, PHAC, Health Canada resources related to vaccines. All the latest updates are there from all the scientists right around Canada and the world. Provincially, we have updates on our site as well related to vaccines, vaccine type, vaccine risk as well. And there's a lot of other reputable sites to go to, including the CDC, including the WHO, to get that trusted information. What we have had seen happen in the past is a lot of misinformation out there, and we need to mitigate that. That causes problems. It causes problems not only at the individual level, but at the community level, and for us at the provincial level as well, and nationally and internationally as well. Let's look at real good, trusted information from scientists around the world who are affiliated with trusted organizations like I had mentioned.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. Do you expect that there will be a point if infection rates and transmission rates decrease to a certain level that those workers that are required to be vaccinated but have chosen not to be will be able to not have to undergo testing, or will be able to, if they're on leave, to return to work at a certain point without being vaccinated? Or is the plan right now just to keep those requirements in place indefinitely?
The plan right now is to protect Manitoba, is to protect the acute care system, is to prevent deaths, prevent hospitalizations. So everything we're doing from a public health perspective is trying to do that. There are no plans to deviate from that in the short term. I think, in the future, at some point, obviously, from a public health perspective, we don't want restrictions. We don't want to have these things in place. If and when that is safe to do, we'll be looking at removing orders and restrictions and requirements. But for the next few months, for sure, nothing will change. And we see this continuing for sure into the new year at this point.
Okay, I do have a question for Dr. Reimer. I don't know if she's back on.
Yes, Dr. Reimer is back with us.
So Dr. Reimer, when it comes time to administer the vaccine to 5 to 11-year-olds, will Manitoba prioritize access to First Nations children and those in remote communities?
Yeah, so what we've been told by Pfizer is that we can expect that there will be a large quantity of vaccine available. And so we're certainly optimistic that we won't have to follow a similar prioritization exercise that we did with the adult population back in the spring. But now, in case there is any delay or anything like that, our pediatric advisory committee has been going through different risk factors, including things like individuals who live on First Nations communities. And they've produced a priority list that could be used if we needed to do that. But we're certainly still being told that that likely won't be necessary, and we'll be able to roll out to many communities at the same time.
From Global News, Will.
Yes, hi, good afternoon. When it comes to breakthrough infections, Dr. Reimer, I know you've said it needs to be thought of relative to the total population of vaccinated individuals. Now, I'm wondering, can the same be said for hospitalizations and ICU admissions? I know based off the messages we receive, some people are saying, I thought this shouldn't be happening. People just shouldn't be getting severely sick if they've been vaccinated. Can you explain a little bit about what's going on there?
Yeah, I mean, again, we know that these vaccines are not 100% effective. So even in the original trial, they quoted numbers like 94, 95% efficacy against the virus, which still means that there's 5 to 6% of people who could still become infected even if they're vaccinated. What we've seen both in Manitoba and around the world is that for those people who are infected after being vaccinated, they are also less likely to develop severe outcomes. But again, it's not 100% there either. So we will always see people experiencing severe outcomes, even if they're vaccinated. But what's really been remarkable is the dramatic drop that we've seen in those severe outcomes in vaccinated populations compared to unvaccinated. The charts that look at those two groups show very dramatic differences. And so while we have had a few people end up in the ICU after being vaccinated, it truly only is a handful of people, despite the fact that there's 1 million people in Manitoba who've gotten the vaccine. So we're very confident that this vaccine is the best way to protect yourself, the best way to protect other people, even if it's not 100%. We try to think of it more like a seatbelt. It's a great way to protect yourself, but it won't protect you 100% of the time in a car crash. So the more people who are vaccinated, the larger proportion we may see amongst those having severe outcomes, just because there are more of us.
Okay, thank you very much for that. And bouncing off that same topic, are there other maybe risk factors that would put you at a higher risk, say age or anything else, if you've been fully vaccinated, I mean?
Yeah, so it's the same risk factors that put you at higher risk of severe outcomes if you're not vaccinated, with one additional maybe emphasis on people who are immunocompromised. So even without the vaccine, people who are immunocompromised might have been at higher risk of severe outcomes because they would have less ability to fight the virus. But that gets compounded by the fact that they are also less likely to respond appropriately to the vaccine and mount a strong immune response. So now they have the dual factors of being both at a higher risk of the severe outcome from the virus and also at a higher risk of not having a good immune response to the vaccine. But other than people who are immunocompromised, we're talking about the same groups. The highest risk are those who are elderly, those who have many health conditions that might not allow their body to fight the infection very well. But even there, there's always going to be some people who don't have those risk factors and still end up in the hospital. So this is something that can impact all of us. And that's why we want everyone to be as protected as they possibly can be.
Thank you very much.
From the Brandon Sun, Drew.
Thank you. Dr. Atwal, today you released some numbers about the number of certain public sector workers who are fully vaccinated versus the number who are choosing to be tested. And I'm wondering if the province had forecasted those numbers at all beforehand, like whether there were any estimations made about how many would choose the testing option and whether this is relatively in
you kind of tuned out there a little bit, but from the pre-implementation side of this, I mean, the only estimates that we had were based on just vaccine uptake by population in certain areas. So, you know, we're kind of using that as a proxy, and I would say that would be the only awareness that we had because we didn't have information to people's vaccination records.
Okay, thank you. And just on a slightly different topic here, you were saying earlier that, and you've been saying before that, for some people who are going to the hospital, they're getting their first COVID-19 test there. So is there worry on the provincial end that there could be widespread spread of the virus that isn't being picked up by tests?
So that statistic we brought up many times before as well. So I mean, that number has been roughly floating around there for, I want to say, a couple of months here now as well. So we have messaged out in the past related to this as well. So that is concerning. Even at this point, with all the information out there, with all the media attention to it, all the work that's been done on the ground with education and working with different sectors and people and communities, you know, there still is a bit of an adherence issue related to when one is sick to go get tested and stay at home until that test result comes back. So that number, I don't think has really gotten higher than that. I mean, for the odd, week or two, it's been a little bit higher. It has been lower as well. So that's the number that we've been seeing. Obviously, we know we're missing out on cases. We've known that for a period of time in relation just how COVID-19 circulates, and a lot of individuals might have very mild symptoms or almost be asymptomatic. So we're looking at all of our markers, we're looking at all the indicators, we take all of the information in. We're just using that as a point where we know that when you're sick, you start to get sick with COVID-19, you'll be sick for several days before you're sick enough to be in hospital. So it's a number of days. Usually it's up to about 10 days before one presents to hospital. So the point of stating that number is, some people are sick, getting sicker, and still not testing. And still not testing until, something bad happens, they have to end up in hospital. Again, when you think about all those contacts that individual may have had, and perhaps that individual is, not desiring to go get help, and that, further puts themselves at risk. We want people to get tested early so we could help with that case and contact management. And from a case perspective, public health connects with the case on a regular basis while they're sick as well, to ensure that if they need care, we'll be able to provide that care to and bring care out to them, or ensure that, they're brought to the hospital if need be in a safe manner as well.
Thank you.
From CJOB, Skylar.
Hi, Dr. Reimer. I got a question for you just about the language behind the third dose rollout. Of course, more Manitobans are getting eligible for this as we go week to week. It does seem a little different compared to the first round of vaccination, where the push was, just simply basically get vaccinated. People are wondering, if their 6 months have passed since their second dose and they are eligible, should they be going to get the vaccine?
So I think the language has changed a little bit in that we're trying to talk more about what are our recommendations as opposed to the eligibility and serving that gatekeeper function. In the first dose time period, even the second dose, we were really struggling with not having enough vaccine available for everyone who needed a dose. And thankfully, we're not in that circumstance anymore. We have enough doses for everyone who is 12 and above in Manitoba to get 2 doses. And we even have enough for many people to get a third dose. So we're now talking more about, well, when do we recommend for someone's health that they get another dose? It's not about us saying you can't have it. It's about saying, when would it be beneficial to somebody versus just being an additional risk with no added benefit. And what we're seeing is that for elderly people who live in congregate settings, that there is a risk that the protection from 2 doses may not stay high 6 months later against severe outcomes. And that's why we're saying it's important for these individuals to get that third dose. So for anyone that we've recommended a third dose and the 6 months have passed, I would say absolutely that is our recommendation, is that individual would benefit from an additional dose to bring up their protection against those severe outcomes and also to help protect everyone else who lives in that congregate setting with them, so that we don't have outbreaks occurring in assisted living facilities, for example.
Great, thank you very much. Obviously, we're awaiting hopeful approval of the shot for younger aged kids, which is a decent portion of our population. And you did mention a couple of weeks ago that more and more Manitobans are going to be made eligible for booster doses, and a good portion of us could be eligible by the end of the year. So there's a decent chance these two campaigns kind of overlap. Is our existing infrastructure going to be enough to handle that? Because I know we are closing a couple of super sites as we roll along here, and the need is lessened, but it seems like there might be a sudden uptake in this. I know Mr. Boats is not here, but might be a question best suited for him, and tell me I'll miss him.
I'll let him know. Yeah, so we do have a planning team who's looking at numbers right now to make sure that we have the infrastructure in place. But the helpful thing now is that for third doses, we're not experiencing the same urgency that we did for dose 1 or dose 2. We're talking about people who do have some protection against this virus, unlike the absence of protection many people had back in the spring. So we don't necessarily need to drop everything else that we're doing in the healthcare system to be able to provide 30,000 doses in one day. And so we're trying to move back to some of our more normal ways of providing vaccine in physician offices, in pharmacies, with our public health teams, but with some enhanced supports, because we do want to make sure that people aren't waiting for a vaccine that would be beneficial to them. So yeah, the planning team is working on this and making sure that there are many different options available to Manitobans so that they have as low barrier as possible to getting a third dose. And as we expand the recommendations, that planning team is going to have to continue to reanalyze the numbers to make sure that the demand and the supply are matched appropriately.
And from the Winnipeg Sun, James.
Good afternoon, Dr. Reimer. I'm just wondering, is there any new research on natural immunity and its contribution to potentially reducing infection numbers?
Well, much like with any virus, we do expect that there would be some protection after infection that an individual would have. But we have more data from the vaccine than we do from the infection, because we've given 6 billion plus doses of the vaccine and have certainly not had that same number of infections around the world. And so what we're saying to people is, while there may be some protection, we just don't have enough information to say confidently how long that protection lasts, how well it works with different variants. And we do have the confidence in the vaccine because of the much higher numbers that contribute to our research studies showing how well these vaccines work against variants and work over time. There are some small studies that show that getting a vaccine after an infection leads to a wonderful immune response. And so it's even possible that people who have had an infection plus the vaccine could be the most protected of all of us. Those are small studies, but they're very encouraging to tell us that there's still a benefit. Even if you've had the infection in the past, you can get an even more robust immune response after the vaccine, despite having that infection.
Perfect. Thank you very much.
All right, folks, we have time for a very brief scrum, a couple more questions. And again, if any questions went unanswered, please send your follow-up inquiries to newsroom@gov.mb.ca. Please proceed.
Hi, Dr. Atwal, you had mentioned that you were expecting 5 to 10% growth a week, but yeah, I just looked at the math. We're actually 25% week over week right now. So based on that, what do you think is coming for the next week?
Again, when we're looking at it sort of in short time frames, we're going to see an uptick, right? So going from 80 cases or 85 cases to 100 cases a day on a rolling 7-day average is a 17 or 18% uptake in cases. Is it, when I mentioned we look back the last 4 or 5 weeks, we've been sitting anywhere between 80 and 100 cases as a rolling average, sort of up and down as well. So again, it is hard to predict that future, right? It all depends on the interactions as well and how people are adhering. And when I said, a 5, potentially or 10% increase in cases over the next couple of weeks, I didn't mean compounded either. It was very specific to perhaps a 5 or 10% increase in a week or two. And that wouldn't be surprising at all. But it wouldn't be surprising if we stayed at the same level, roughly around 100 cases on a rolling 7-day average as well.
We're above that. We're at 108 rolling average today. We were at a high of 112 during this 4th wave. We'll probably exceed that tomorrow, barring a very low case count. So we like I said, we're up at 108 today. That's the 7-day average.
And again, we'll continue to monitor, but again, it wouldn't surprise me to see, a 5 or 10% increase on a week-to-week basis for a couple of weeks. That wouldn't surprise me.
Dr. Atwal, the Winnipeg test positivity rate is about 2.5 times less that of the province at large. Obviously, 56% of Manitobans live in the health region. And I think a lot of them aren't as concerned about the numbers at large these days because they see, how many active cases are in the Northern Health region, for example. So can you speak to the, the risk of the virus in the city where there's a lot more population density compared to some of the northern or southern areas of the province where it might be because of localized outbreaks?
So the test positivity is high, let's say in certain areas, or on a rate basis, the rates are higher in certain areas, and those are related to, let's say in the north, we talked about sort of a couple of communities there with some significant outbreaks that really skews those numbers when you're looking at it from a population perspective on a rate basis. Winnipeg's numbers have looked great. We've continued to maintain some low numbers here for a long period of time as well. And I think that shows to the amount of vaccine uptake that's occurred in Winnipeg, right? So when you look at Winnipeg and the region, the WRHA area has very high vaccine uptake. I think it's over 90% in those that are eligible. And that provides a lot of protection, especially when those that are unvaccinated are spread about, randomly throughout that population. That provides a good level of protection to the unvaccinated as well. And, there's a lot of work being done with businesses and with the orders and proof of vaccination that helps mitigate that risk as well. We've had a number of larger events occur as well with lots of individuals there, indoors and outdoors, where we haven't seen outbreaks occur as well. And that proof of vaccine concept seems to be working quite well, not just here, but we're learning from other jurisdictions as well, and they're finding the same. So again, we're going to continue to look at those numbers and assess risk. But you're right, Winnipeg is doing quite well from a case generation perspective. It is densely populated compared to, let's say, other regions. But in Winnipeg still, when you can look at a lot of houses in the north or in some other areas, there's a lot of housing issues. Not that we don't have housing issues in Winnipeg, but we have less so on a percentage basis on a population basis as well. So there's a number of factors here that cause case generation. And a lot of this, when you're looking at different regions and smaller communities and outbreaks in smaller communities, really skews those numbers. I think Winnipeg in general, again, it's relatively safe, I would say, being in Winnipeg and doing one's activities. And again, the orders and the restrictions and the vaccine uptake has played a tremendous role in that safety.
Time for one more question, folks.
Dr. Reimer, the booster shot or 3rd dose that's being offered, I'm wondering, is it the exact same vaccine that was being offered originally, or has it been updated in any way to account for the arrival of the variants?
So our current recommendations are to use the same product that an individual received for dose 1 and dose 2. Moderna is working on a half dose submission, and so we certainly would potentially change our recommendations depending on Health Canada's review of their submission. But the companies have done some analyses of their booster doses, even with the same formulation and the ability to protect against variants, and found that the original formulations are quite effective against the variants. So for the time being, we are using the same product that was used for dose 1 and dose 2, but always open to shifting if there's new products that are shown to be more effective in the future.
Thank you, doctors. Thank you, everyone. Please forward any further questions to newsroom@gov.mb.ca. Thank you.